When your vet recommends giving your cat fluids, I'll go over how to do that for your kitty. I've got Moby here to help demonstrate that for me, and she has chronic renal failure. And what we're going to do is, when we start, we want to find a time where it's a quiet, peaceful time. I think evenings are usually a good time, and we'll just approach Moby when she's quiet and relaxed. And then we want to have everything set up ahead of time too. So your vet will have provided you with the supplies, a bag of fluids, the fluid line, and the needles. And what you'll do is first take a look at where your fluid level is. This bag of fluids is right at the 1, and each increment is 100 mils or 100 cc's. And for Moby, I want to give her 100 cc's. So I'm going to watch when this line of fluid gets down to the 2, then we'll be done. That will be 100 cc's. So I think it's helpful to put this, of course I have a nice little IV pole, but it's going to work better if you put this bag of fluids on a hanger and maybe hang it up on a door someplace high. And then if you can get as low down to the ground, either on a couch or preferably on the floor, if you're both comfortable on the floor, the higher up the bag of fluids are, the faster the fluids will run and everything will go faster. So I have it up here, and then I've got our fluid line. There's going to be little fluid clamps. Right now this one is clamped closed, and then we've got our needle here and plenty of fur. And so what we'll do is we'll take the cap of the needle off, but where we're going to give the fluids is right over the shoulders. Yeah, and so what we do is we just kind of tent the skin, and they have a lot of skin in this area, so we're just going to tent the skin up, and where that the center part of that skin fold is really where we're going to give the fluids. We'll take the cap off there. You'll also notice when you look at the needle that there is a bevel to the needle, meaning there's a part where it's angled. I'm used to giving that the needle bevel up. So when I insert it into the skin, it's going to be at this angle. So I'm just going to pet her in this area, kind of tent up the skin, and then just poke it through the skin. And certainly with practice, I can tell that that's going under the skin and is in there. Then I'm going to, so it's just sitting there, I'm going to release the clamp, and now the fluid should start flowing. And the way you can tell is by looking up here that there's a little drip that's going. If it's real slow, like that's a fairly slow drip, you might try redirecting the needle just a little bit, or getting your bag of fluids up higher. And so during this process, you can just pet your kitty's cheek and ear, and as the fluids are going. It does take a little bit of practice, but oftentimes you can do this without any assistance. If your kitty tries to get up and walk away, just kind of pet her back into a lying down position, and they really tolerate this very well. I do try to keep my hand here so that if she does get up suddenly, this doesn't immediately come out, that I kind of stay with her. But I'm not pushing it in, all I'm doing is just holding it steady. When you are administering fluids and maybe noticing that the drip rate, that it's not flowing real fast or real smoothly, you can actually go ahead and clamp off the fluids, take the needle out, and try a new location, because sometimes it's just a matter of finding just the right location. So do give that a try. So after your fluids have flown and you reach the level that you want, I'll keep the needle in position, and then with my other hand I'll find that little clamp, and then I'll clamp it off. So I want to clamp it off before I take the needle out. So then I'm going to kind of pinch right where the needle is and just pull out. And then I usually keep it pinched for just a moment or so, but it's normal for a little bit of fluids to come out. Then I'll very carefully put the cap back on the needle and set that aside. And there may be a little bit of a wet spot where you gave the fluids. Now, if some things that can happen is if you poke it all the way through the skin, when you turn the fluids on, you'll see, or if you're not all the way through the skin, fluids will start leaking when you give it. So if that happens, don't be alarmed or don't panic. Just go ahead and clamp off the fluids and reposition. When you're done, there will be kind of I call it the humpback. There's going to be a kind of a balloon of fluids under her skin, and but that does absorb. Sometimes it starts to kind of migrate down their legs a little bit too, and so if you later on see them walking and they've got some fluid under their skin, it's just shifting in its distribution. Another practice tip for you, if you want to practice this before actually trying this on your cat, is to take a banana peel after you've eaten the banana and maybe go over by a sink or someplace and practice taking off the cap of the needle, poking it through the banana skin, unclamping your fluids, and then reclamping your fluids, taking the needle out of the banana peel, and just practicing that. So, because there's a fair amount of coordination involved, and so if you want to get through that before actually trying it on your cat, that may help you out. Another tip, if your kitty seems sensitive to the fluids, it can help to warm up the bag of fluids just a little bit. This is just room temperature, but it feels cold when it goes into their under their skin. So you can just warm this up. I usually would put it in like a hot water bath, just warm it up to about body temperature, about no more than 100 degrees, and just warm that up. And then sometimes that feels warmer when it goes in and isn't as objectionable. I really think that giving your cat fluids is one of the best ways to help maintain a really good quality of life, especially for cats that are in renal failure. It can be a little intimidating at first to try this process, but with practice, you'll really be doing a wonderful thing to help your cat have a good quality of life.